Good morning. Welcome to The Doctor is In, Ask Dr. Arwady. It's Thursday, February 4th, and we're so happy to be with you to give you the latest on COVID and on the vaccine for COVID. I'm Sybil Madison, your Deputy Mayor for Education and Human Services, here with Dr. Allison Arwady. She's your Commissioner for the Chicago Department of Public Health. You can send us your questions using the chat box below. You can also use the hashtag AskDrArwady and send us those questions through Facebook or Twitter. We're going to check our distance.
Looks good.
Even though Dr. Arwady is fully vaccinated, we still must do the things that we know work, which is to wear masks when we cannot keep 6 feet of distance, to keep that 6 feet of distance, and to use good hand hygiene. Those things have not changed. You want to give us the latest?
Sure. So there's been a lot of really good news, I would say, on the vaccine front. And I'm sure people may have questions, but we saw some good preliminary data coming out of the Johnson & Johnson vaccine. Certainly expecting that that will probably be assessed by the FDA. So if everything looks good on that in terms of safety and efficacy, we may be looking at a third vaccine available here as soon as maybe March. So that was really good to see. Also, if people didn't see, I was thrilled to see our first data that was looking at not just protection for the individual yourself, but how well does vaccine help potentially protect others. And this is there have been a number of studies that have been ongoing with all of these vaccine trials, and this was out of the AstraZeneca one, out of the UK version of that. That's not a vaccine that's been approved here yet. The FDA has been waiting for the US trials to finish, but it has been completed and is in use in the UK. And they did, as a study there, not just looking to see who got symptomatic COVID, but swabbing everybody who was in the trial, whether they had symptoms, whether they didn't, to see if it was possible that they had vaccine, were an asymptomatic carrier, and then could potentially maybe go on to spread to others. This has been an unanswered question. Moderna has done a similar study, and even in their initial presentation, just this one portion had suggested that there would be protection there. And then now this AstraZeneca.
Got it.
In the UK, they were looking at after only a single dose of vaccine, and after that single dose of vaccine, they had seen that people were about 76% protected themselves. Very good after a single dose of vaccine. But importantly, they also found that there was 76% protection for others in terms of people not having, asymptomatic carriage of virus. So really, really positive news there. I expect to see additional data like that coming with some of our current vaccines, but it really continues to look good here. Certainly a little bit of concern, just while we're talking science updates, as we're following these new variants, particularly that one that emerged from South Africa, or at least was first detected there, where we are seeing some of the vaccines not be as protective. To be clear, they are still protective, but you may be dropped from that 95, 80s, more to like a 50% protective mark. And so the scientists are already working on if we needed to do booster doses, if we needed to think about being able to change for variants. One of the good news about the mRNA vaccines, which is the Pfizer and the Moderna, is that technology can be adapted much more quickly than a traditional vaccine should it be necessary. But the bottom line is that the vaccines that we have continue to work against all of the variants that are available. And it's important that as you have an opportunity to be vaccinated, you take that opportunity. Please, continue to ask your questions. We have a million things going on, but we have remained committed to doing these Facebook Lives because we think it's really important to get your questions directly. And especially if you've got questions about vaccine safety or efficacy, we want to help answer them. Chicago.gov/coronavirus is always your one-stop shop for everything COVID here in Chicago. Right up at the top, that vaccine tab, lots of questions answered, lots of videos, lots of details about how the vaccines work. Please explore that site, send people there if you know they have questions about the vaccine, and continue asking your questions. Let's look quickly at the dashboard. I know that was a little bit long, but science updates are good. So briefly, our dashboard news also looks really good. So we're at 5.4% positivity here in Chicago. Yay! The lowest we have been in about 4 months since the very beginning of October, getting really close to that 5% mark, which really puts us feeling very happy.
Very happy.
Very happy. And similarly, look at that case average, 539 cases per day. Also the best we've been since the very beginning of October, getting down close to that 400 mark that we really want to get back under in terms of moving out of that higher risk territory. And those numbers continue to look good. And that has been with some careful reopening. So we're pleased about that. It tells us that Chicagoans are broadly continuing to do the things that we know work. And, you know, I put my head into a restaurant yesterday and everybody was appropriately spaced, 4 people max at a table, no more than 25 in there, you know, doing this carefully, doing this cautiously, moving the dial. We keep seeing numbers like this. We're going to keep being able to move that dial and really feeling good. And then similarly on the vaccine, I'd encourage you to explore the data yourself there. We're at 1 in 17 Chicagoans have already gotten that first dose of vaccine. 1 in 8 Chicagoans over 65 have gotten that first dose of vaccine. And as a reminder, most of the data that we report out is for Chicago residents. We're doing a lot of vaccinating of non-Chicago residents. I looked at it today and still about 36% of the vaccinating that we're doing here is for non-Chicago residents.
And is that because these are people who work in Chicago and they're getting vaccinated?
For the most part. And then so much of this has been employer-based. We saw this in 1A where we were vaccinating healthcare workers, and it was about that percentage of healthcare workers who live outside Chicago but work in our hospitals, work in our clinics. We obviously want those settings highly vaccinated, not being sources of spread. And so we are pleased to vaccinate people who live in Chicago, who work in Chicago, who get ongoing medical care in Chicago. We don't want people broadly driving long distances who don't have connections to Chicago. But most of the vaccinating we're doing, you know, continues to go to Chicago residents. And those numbers that we report, that 1 in 17, that 1 in 8, that's just the Chicago residents. We're also doing a lot of vaccinating of non-Chicago residents. So things are going well there. And if you've also got questions about logistics or our Protect Chicago Plus initiative or how we're pushing vaccine to where it's most needed in Chicago, also happy to take those.
All right. Hey. Time for questions?
Time for questions.
Okay. Beverly Stewart Williams from Facebook. There are 2 questions here. So let me do the first one. People keep saying do not take meds before you get vaccinated. Is this true?
So, there's a theoretical, let me take one step back. So remember, how does a vaccine work? A vaccine is teaching your immune system to recognize a potential invader like COVID-19 and teaching your immune system how to fight it off without ever making you sick. Sometimes as your immune system is learning that lesson, you will get some side effects. That again is not COVID, that is not making you sick, but we do see people get a sore arm, sometimes a low-grade fever or feeling tired, muscle aches, for typically, you know, a day, 1 to 2 days. And those are the symptoms for which people will sometimes take a Tylenol or an ibuprofen, you know, Advil, Motrin, et cetera. There is a theoretical concern that if you take a medication like, you know, an ibuprofen, that in some ways is actually tamping down your inflammatory responses, could there be a theoretical risk that you're a little bit not having as much of an immune response? It's a conversation we have around regular vaccines anyway. I don't have major concerns about it. What I recommend, and this is in line with what the CDC and others, to the best of my knowledge, have been recommending. I recommend that you don't take a medication proactively. So don't take Tylenol or ibuprofen before you get a vaccine. Okay, go ahead and take the vaccine. The vaccine itself is not painful. I've given a bunch of these at this point. You know, I had my own. There's not really pain right at that time. And many people don't have significant side effects at all. But if you're having side effects that are really bothersome, go ahead and take a Tylenol, take an ibuprofen after the fact. Again, that's just helping sort of with your comfort level. But I don't think there's a need, and I wouldn't recommend proactively taking those medications. Tylenol and ibuprofen, Tylenol's got about a 4-hour window, ibuprofen's got about a 6-hour window. That's not the time frame that we're seeing those side effects appear in anyway. So I hope that helps.
Okay. I think that answers Barbara Putria's question too. which she took a Tylenol the day she got the first dose and was worried that it would impact the effectiveness.
I would not be concerned about that. Really, this vaccine, the reason we want people to, use the vaccine for protection and not just depend on natural immunity is that there's a lot of work done to make sure it's a consistent sort of exposure to the amount of the vaccine and then a consistent immune response. You are not going to not get immune protection by taking a Tylenol. So again, don't take one up front. There's not a need for it. If you're having significant symptoms afterwards, you can take one. This is the same thing we tell to children when we're vaccinating, doing regular childhood vaccines. We've not seen major signs of interactions there, particularly with Tylenol.
Okay, and so then Beverly, I didn't forget you, had one more question. Do you know if KN95 masks are safe? And I'm not quite sure why they wouldn't be safe.
KN95 masks, they are. So there's a lot of different kinds of masks. And again, let's just take one step back and say the most important, 95% of this conversation is just about, are you wearing a mask? If everybody is wearing a mask, even if it is the most basic mask that somebody has handmade, that is more important than the detailed conversation up here about the specific type of mask. But that said, we don't want people wearing a mask that's got a valve on it, the kind that lets your breath leave. And there are dust masks, for example, that are designed to keep dust from coming in to you. But then there's a valve that, normally if we weren't using it for protection, they use these in construction, et cetera, it helps your breath leave. We don't want those. And those are not broadly available, but that would just be the one thing I don't want to see people wearing. Because remember, what does the mask do most? The mask protects others. It also provides some protection for yourself, but mostly you're protecting others. So we want to keep your germs with you. So number one, a mask. Number two, a mask that you are wearing appropriately. So a mask that covers your nose, covers your mouth, has a good fit. That's the biggest and most important thing. Then there are different types of masks. N95 masks are the ones that typically are used in medical settings.
We heard a lot about them at the beginning.
We heard a lot about those. Those are the ones that CDPH luckily had millions stockpiled heading into this pandemic. And those are mostly used in medical type settings. KN95 masks are sort of a slightly different version of that. Yes, that is a good mask to use, but I don't want you thinking, I don't have a KN95, I shouldn't use this. Just wear a mask, and if everybody wears a mask, we will be in good shape here, really, truly, honestly. So KN95 masks are safe, cloth masks are safe, N95 masks are safe. Just don't use the one that's got the one-way valve on it, and wear it over your nose and your mouth. Wear it consistently. Keep your distance on top of that. Remember, mask is apart, distance, even more important in a lot of ways if I had to take a guess. And then avoid crowds, right? Avoid risky situations. So Super Bowl's coming up this weekend. Yes, our numbers look better. Please don't use that as an opportunity to have a big raging Super Bowl party. Not the time for it. Our numbers are better, but they are still not where we need them to be. And
should we still be thinking about kind of our household bubble? I know we were talking about that during the second surge.
Yeah, I mean, as we've been emerging from this a little bit, this is where we no longer have the requirement or the strong advisory that you should not be seeing anybody outside your household because we're doing better. But where you can continue to limit unnecessary interactions, that's just safer. As our numbers continue to go down, it's going to be, hopefully, more and more, there's less risk when you're gathering. When we've got numbers, 539, that's still above where I want them to be very clear. We got to get under 400 before I'm feeling like, risk in a random gathering is going to be that much lower. So where you are thinking, especially if there are people in your household bubble who have those underlying conditions, right? If there are people who are older who have those underlying conditions, please, continue to be cautious here. I'm happy with the way things are going. We're being cautious here with our reopening, just to kind of expand on that. We have sort of reimposed some city level mitigation in place here, and we will be using that dial to reopen. We're watching the variants, we're watching our numbers, we're watching sort of what we're learning about risk in different scenarios. We want to be as open as we can be, and the way you can help with that is by doing the things that work and not taking unnecessary risks. And especially if you've got people in your household bubble who are at risk, please keep being careful about COVID.
Okay. Aaron Hoffman from Facebook, what percentage of positive COVID tests are being screened for the new variants?
Oh, really good question. So it's a low proportion. And the way sort of what's called a surveillance strategy works, a surveillance strategy is a goal of setting up a selection of tests that are taken from different settings that allow you to look for concerning signals. So you can't do this test on using a regular COVID test. You have to do it in a really very specialized lab. What you're doing here is you're taking the genetic fingerprint of the virus. And that is something we didn't even know how to do as a society if you look back, a few decades ago. And it still is something that requires quite specialized equipment. And so we worked here in Chicago, for example, even before these variants emerged, we had put about $3 million and put out a contract. Our academic centers here do this and have been doing more of this. Every time a genetic fingerprint is taken, it does get uploaded sort of into the cloud. It's shared, again, not without any private identifying information. And we'd invested to have more of a coordinating center around this so that it's happening. So the CDC has set up a strategy where a certain number, depending on population, are kind of taken from different settings across the city, across the state, across the country, and then where we see particular signals, you may gather more. But it's low. It's probably, I honestly don't know the number off the top of my head, but the number getting that full genetic sequence is almost certainly less than 1%. But where we see points of concern, we would then double down and sort of do some more of this. But the reason, we want people to really not, you don't do anything different related to the variant in terms of how you behave, except be extra careful about the things that we know work. And so we want people to assume that it's a variant, right? And if it's a variant, we are going to do the same contact tracing. You are going to do the same things related to being careful with isolation, staying home when you're sick. Like, it really is a lot of that very same messaging. It doesn't change what we do, but it does change us, being very careful about the way we're pushing vaccine. We really want to get vaccine into the settings that drive our outbreaks here, whether those are individual locations, whether those are some of the communities, whether those are some of the settings where we've seen a lot of spread, because getting those settings under even better control decreases the risk of spread, which decreases the risk of variants, which decreases, everybody's risk here in Chicago. So we're thinking a lot about it in our vaccination strategy. We're working to try to build up additional, that sort of more technical surveillance in areas that we're concerned about, and academic partners all across the city are doing more work in that space. But it is a small percent.
Got it. Okay, Candy Girl Mays from Facebook. I have hypertension, type 2 diabetes, and anxiety. Is the vaccine safe for me to take? Where can I research the data where I will feel safe to take the vaccine?
Okay, great. So yes, the vaccine is safe for you to take. And in fact, for somebody who has hypertension and diabetes, those are both risk factors for more severe outcomes from COVID. We know that people who have diabetes and hypertension are actually more likely than other people to get sicker from COVID or to be hospitalized from COVID. And so people who have underlying conditions like that, we especially want you to feel confident in terms of getting that vaccine when it's your turn. I don't know how old you are. If you're over 65, you would be eligible now to get that vaccine. If you're under 65, you would be eligible as we move into phase 1C. So at the moment, we're anticipating that may happen at the very end of March, really into kind of April and May, depending on how much vaccine we get available. But in the meantime, so the first place I would point you really is to chai.gov/COVIDVax, COVIDVAX. You can get there, as always, off the chicago.gov/coronavirus page, and look at some of the information that we have up there. We've got, I think, spelled out in quite a lot of detail, a lot of languages, some of the information about safety. I've done a couple of science behind the vaccine videos that are posted there that answer questions like, how do vaccines work? How do the mRNA vaccines work? How were the trials done to know that this vaccine is safe and effective? So I'd point you to that if you want local data. Otherwise, the CDC also does have a lot of good information available. And then all of your other other places where you get trusted health information. So, if you get information from the American Diabetes Association, for example, they will have information most likely about COVID vaccine and its safety, and likely be encouraging you to get it. And then talk to your doctor if you have additional concerns. I want people who are at higher risk for COVID and at higher risk for bad outcomes from COVID to feel confident in getting that vaccine. So thanks for those questions. And after you look at that, if you've got additional questions, come back here and ask them, and we'll answer them.
All right. Avery Davis from Facebook. Since testing sites are closing for the next 5 days beginning tomorrow, will vaccination sites be closed as well?
Good question. So just in case people are not aware, we are about to enter what may be a record-breaking cold phase here in Chicago. And so in that setting, we have activated, our planned winter testing strategy, which means not having those testing sites open. That is because those are out-of-door testing sites. People are in vehicles, but the staff are out of doors. Yeah. And although we've done a lot to make them, relatively able to function in our cold winters, when it gets to this level of cold, honestly, from a safety perspective, we don't want the staff and the volunteers, potentially being exposed. And, there are walk-up availabilities at the site. We don't want people walking up when it's that kind of weather. Our vaccination centers, on the other hand, broadly, are indoors, remember. And this is one of the things that where we've got big plans for doing massive vaccinations in more out-of-door settings when we are not in January and February and March here in Chicago.
And when we have more vaccine.
And when we have more vaccine. That's the biggest one, exactly. Like, we're still getting 5,700 doses of vaccine every day to go across the entire Chicago population. There are, again, almost 750,000 people who have been eligible here in 1B, not even including the people who are eligible in 1A and are now deciding to get vaccinated. So we still, each week, we get less than 5% of the vaccine we need to vaccinate that population. So back to the question. At the moment, we are not planning, to the best of my knowledge, to close any of those vaccination sites. If there were to be significant snow or other concerns in terms of being able to get to those sites, I suppose we could need to make a change on that. But most vaccination, remember, is happening in doctor's offices, in hospitals, inside pharmacies, in dedicated employer settings, and then in our larger kind of mass vaccination points of dispensing at city colleges. And those are designed to better be able to handle winter weather.
Okay. Alejandra Garcia from Facebook. How are you advocating for seniors who don't frequent doctors or who have, I think she means don't have access to technology, like so many in Little Village, for instance?
Okay, perfect. So first of all, there are some vaccines that are made available to the general public. And those are the ones that you can sign up for on ZocDoc, like we announced on Tuesday, and I hope people were happy about that. We had, I think, more than 100,000 vaccination requests or appointment requests coming in, like in
immediately
minutes. Yeah. But we, so the ones that are publicly available, meaning like you can get on a pharmacy website and get an appointment. You can get on ZocDoc and get an appointment. But most of our vaccine is not sort of broadly available to the public because we know that there are people who are not connected to the internet, especially seniors, and we want to make sure that those very most vulnerable people are getting vaccinated. So one of the reasons I was so happy to see how quickly our rate of vaccination went up as we opened 1B, we see vaccine going exactly to where we want it to. People over 80 even, over 70, over 65. And we saw that shoot up because, again, we have pushed vaccine to existing, hospitals, clinics, doctor's office, federally qualified health centers in a closed way, not for the world to make appointments, but say, please reach out to your existing highest risk patients. So where there are doctors or clinics, in the Little Village area, there are clinics that are reaching out to their existing oldest patients, not waiting for them to get online, calling them in the regular way, saying, this is your doctor's office calling, and we think you should get a vaccine. Can I make you an appointment? That's been going really well. Our numbers look good on that. Also, though, Little Village is part of Protect Chicago Plus.
Sure is.
Do you want to maybe just chime in a little bit on that, and then I'll fill in?
Yeah. So Protect Chicago Plus is our equity strategy for getting vaccine starting with 15 communities that are high on our COVID vulnerability index. Little Village is one of those. And the work there is really about partnering with community leaders, community-based organizations, community residents to get the word out, to get the right messages out through trusted messengers and through the channels that work in those communities. And to do just as Dr. Arwady said, to work with community to think about how do we get all of our seniors, how do we get all of our essential workers in this community, and to partner with organizations to have vaccination events, to partner with our hospital providers and our FQs to bring strike teams to places like independent living facilities where we know our seniors are. And to also have outreach workers who can go door to door, who can show up at grocery stores, at laundromats, and pre-register people for vaccination appointments that are going to be at those clinics in those communities. So a lot of work that is really on the ground, grassroots, working closely with partners in those communities who know where their residents are and how we need to get to them and what they need to hear in order to feel good about getting vaccinated.
Yeah, and I think, if you remember, we launched the Protect Chicago initiative really as the second surge was kicking off, and we wanted to make sure we had a lot more, in addition to the digital strategies and the cross-city strategies, some real on-the-ground focused outreach in our hardest hit communities. And so for months, there have been city workers, safe passage workers, volunteers, community-based organizations knocking on doors, like 400,000 doors in our hardest hit communities, making sure that people who might not be connected to the internet were getting, testing resources, information, help with quarantine and isolation, making sure they knew how to make a COVID plan, really trying to do everything we could to make sure those communities understood their COVID risk and what they could do to help protect themselves. Now that we've got a vaccine available, Protect Chicago Plus, it's the same idea. It's built on successful get out the vote and census strategies, where you're literally going in hardest hit communities, trusted messengers, people who live in those communities, and imagine, somebody with an iPad, kind of like census, saying, knock, knock, can I sign you up for a vaccine? Like, do you have questions about that vaccine? You are a good candidate to get that vaccine. And then making the appointment for you. And then we have a closed point of dispensing, a dedicated clinic for people who live in Little Village or in any of these settings that, again, not open to the general public, made for people who are from that community who we most want to get vaccinated. And then recognizing that other things may be driving the outbreak there. And so if there are other types of workers, other settings that are putting people at risk in conversation with community for COVID, those people also become eligible for vaccine in those communities. We want to push vaccine there to get communities that have been hardest hit at least at the level, if not above, the city vaccination level. So. That's right. Yeah, so, lots of thought going into this, lots of resources going into this, and we really are doing a lot of thinking about how to make sure people who might be less likely to get a vaccine, we can flip that calculus a little bit and lower those barriers.
Okay, Kelly Brown from Facebook, what's going on with the UK variant here?
So with the UK variant here, we have detected multiple cases of that UK variant here in the Chicago and the sort of greater Chicago, Illinois area. I believe we had detected about a dozen cases broadly last I had looked. And there have been hundreds that have been detected across the United States. Mm-hmm. One of the concerns about the UK variant, and really any variant, is that it has the potential to be more infectious, more contagious. And so if people are letting down their guard, not wearing their mask, getting in a gathering, et cetera, there's less margin for error there. But the thing is, the reason, the concern is that that variant, by definition, if it can transmit more, will start to probably outcompete the other variants that are here. So we've not seen anything hugely concerning. Again, our cases are going down, things are looking fine. We've got some of that surveillance in place and growing more of it every day. But I can't emphasize enough, being careful. We're gonna open carefully. We're gonna turn that dial carefully. we start seeing signs of concern, we may need to turn it right back. But we've learned so much about COVID and how to make settings safe as possible from COVID, and have seen those strategies work over and over again. And so we will keep you posted. Maybe I'll even, we could do a sort of weekly update on sort of what have we seen related to variant numbers, and we could sort of add that on maybe, just so people have a sense of where we are. Nothing hugely alarming here, but generally variants are a concern. And they're a reason why we can't just sort of say, oh, we're done with COVID, because we unfortunately are a long way from done with COVID, even while we're making such good progress on our indicators and on vaccination.
Yeah. So there might have been people who were thinking, well, once the vaccination rolls out, I can get rid of this mask. But really important to keep doing those things that we know work.
Not just yet, right? Like, 1 in 17 people is good. 1 in 8 people over 65, I'm very really happy about. However, still, more than 500 cases a day, right? This is sort of the balance. We're doing so much better, but we are not out of the level of, of some concern. And so we want to make sure that there's not settings that don't have mitigations in place. Big crowds, we're not ready for big crowds yet. We'll see. So.
All right. Faye State from Facebook. I read about a clinical trial with Humira at Oxford University. What happened with that study? Do you know about that one?
So, there's a lot of different clinical trials that look at medications that can affect the immune system. I'll tell you, the trial I was most interested coming out of Oxford was actually the one about the AstraZeneca vaccine, which was the one that showed protection also against asymptomatic COVID or the potential for spread. I will look and see, some more details about the Humira. I have not heard anything major related to Humira in particular. So.
Okay, a little Humira homework.
Yeah.
Victoria Northern from Facebook. Will people who have already had COVID experience worse side effects than others who have not had it once they get their vaccine?
Oh, good question. So we are, again, learning, studying, as always, as people are getting vaccines. Remember, there are more than 1 million COVID vaccines going into arms every day across the U.S. right now. The U.S. has done by far the most vaccinating in terms of numbers of vaccines, and we are set up to also collect side effect data, really continue to study this. The biggest risk factor that we've seen in the trials, and I think in real life, most for having more side effects, again, these are not dangerous, but just in terms of having the side effects, is really related to age, and is that older people are less likely to have the side effects. And that is, again, because, older people also more likely to unfortunately have serious outcomes from COVID. This all has to do with sort of how your immune system responds, and it does broadly for older people. It does not respond quite as robustly to natural COVID infection, and that's part of why we see people get sicker. But also, older people's immune systems just do change. We see this with flu shots too. We give higher doses of flu shots to people who are older. So for COVID, this vaccine, to be very clear, was tested in people of all ages in the trials, and it was safe and effective across all age groups, older, younger, in between. But side effects were seen much less often in that older group. So the protection was still there, but you don't have as much of that really robust immune response. I would say on the other end of that spectrum then, people who are younger or who have a more robust immune response generally would be more likely to probably have some side effects from that vaccine. Now, this is not 100%, right? And we know there are some people who just are more sensitive in general and will tend to have more reactions to things. But that would be the thing that we've seen the most related to. I think there's some theoretical that if you've had an exposure to COVID previously, particularly a more recent exposure, you've just sort of had that natural immunity boost, if you will. And so in some ways that vaccine is sort of a boost, right?
Yeah.
And so it is, you're kind of
double boost.
You're kind of getting that extra dose of protection there, and therefore getting a little bit more. You're kind of teaching your immune system again, right? So that is just my hunch in terms of what I know about how vaccines work and what we've seen in the data. But I really want to reiterate that we don't want people to think because I've had the vaccine the virus in the past, I shouldn't get the vaccine. Because again, there's a lot of questions about how long some of that natural immunity lasts. We want the predictable protection that comes from a vaccine, and with variants on the loose and all the rest of this. Like, it's important that we don't depend on that natural immunity. So it may be that if you had it in the past, especially more recently, it's possible you could have some more of that side effect, but we're not seeing anything concerning in that. This isn't dangerous. It's not something that is making people seriously ill. And many people in both the trials and in real life who had COVID in the past, get their COVID vaccine, have no symptoms whatsoever. I didn't have COVID in the past. I got my vaccine, no symptoms, for real. And many people have no symptoms, but I can't guarantee who's going to have symptoms and who doesn't. Yeah. The thing we know about older people, generally less likely. People with more robust, if you have a side effect, if you get a really sore arm or you kind of don't feel good, that you have a really good immune response. That is your immune system kind of learning how to fight COVID, and it will protect you very, very well should you be exposed to COVID in the future.
Got it. It's really kind of fascinating.
It is, right? Immunity is like,
yeah.
Oh, yeah.
I was thinking about all kinds of questions I had, but I'm going to go with your questions. Kim Garrity from Facebook. Hospitals seem to be doing their oldest patients first. Will this continue in 1C?
Excellent question. So we have asked hospitals and clinics, et cetera, to start with their oldest patients. Remember, here in the city, we've got vaccine that's directed to clinical settings. We've got vaccine that's directed to employer settings. These, again, are not the open to the public broadly. These are settings. And the goal is to, in 1B, offer vaccine to everybody who's over 65, right? Mm-hmm. That is actually the goal. It'll depend a little bit in terms of how quickly vaccine comes, but as we open to 1C, just in the same way, like we've talked about this airplane boarding, just because you didn't get on when your boarding group was called doesn't mean you missed the plane. So for all of the healthcare workers or people who live in long-term care facilities who maybe didn't get on the plane in 1A, we definitely want them to get vaccinated in 1B, and they do continue to take some priority there, where we get, in our city pods where people are registering, outpatient home health aides, this kind of thing, who have not been connected. We are working to get them appointments because, again, this is sort of based on risk. And so what we expect is as clinics get through their existing patient lists, they will be able to open up more broadly. Like, this is sort of the idea. You want to make sure you've offered that vaccine, given people their sort of chance to get that vaccine over these next couple of months. And then as you get through that existing list, you can open more generally to the public. You can open more generally, we can keep directing vaccines. So it's a really good question. And I would expect in 1C, where, then we'll be looking at who is under 65 with the most underlying conditions. There will probably be another, attempt to make sure that it's not just, this Hunger Games style of who can get the appointments, but that we're working to make vaccine available, again, to the highest risk people in those settings. This is our whole goal, this sort of equity strategy, the strategy of using vaccine in careful ways here is to not just say the people who raise their hand first and are the loudest and willing to drive the furthest. That's not who always gets the vaccine. We always want to work to drive our vaccine quickly, so to make sure that it's all being used, it's not sitting on shelves, and it's not, just to be clear about that, but that we also are putting some systems in place so that people who need that vaccine more, broadly speaking, have access to it earlier. And it's one of the things that makes my job the hardest right now because, a lot of people are really motivated to get that vaccine, and I love that. I wish we had enough vaccine to be able to offer it to everybody. By this summer, we will. I am very confident about that. But over these next few months, there is this work to try to make sure people who most need that vaccine can get it.
Okay. Oh, we are just about out of time. I think we have time for one question.
Okay.
Let me pick the question. Maria McCabe, this is kind of related to what you just said. Getting notices that vaccines are available, but when I go into the sites, there are no appointments.
Yeah.
When will this improve? I am 76 and my husband is 78.
Okay, good. So for one thing, if I assume that you live here in the city of Chicago, the ZocDoc website that we announced on Tuesday is our kind of one-stop shop for open to the public vaccine appointments, whether those are through our city mass vaccination or points of dispensing, whether those are through, you notice there were a number of health systems, Rush and Amita, Innovative Care Express, Erie Family Health, all opened a portion of their appointments to the general public. And we will continue to be adding, especially as health systems maybe are getting through their highest priority lists, additional appointments in there. Also, as we get more vaccine, this becomes a way to make it easier for people to identify, especially Chicago-based providers, for Chicago residents, people who live and work here, appointments that are in Chicago. The pharmacies are a little different because they tend to be national chains, but there is also vaccine that is working there. And there's a lot of work, I think, especially with the new federal administration, to try to make a lot of this as coordinated as possible. One of the reasons we went with ZocDoc is they're the biggest online scheduler already, like pre-COVID in the world, or at least in the US. And so, it's already a system that talks to all of the existing doctors' offices, and it makes it easier. But to your original point, if you have gotten care at so number one, go to ZocDoc, ZocDoc.com/vaccine, sign up. Make sure you've got an email address in there, and we will email you when additional vaccine appointments become available. So that's one thing to do. Number two is, check with, if there's a hospital that you've ever gotten care at, check with your doctor's office. We've got more and more doctor's offices that are coming online really each week. And if you're 76 and in Chicago, you are a prioritized group in Chicago. And that means that, it may not be this week, it may not be this month. A lot of folks are likely going to be in March, but there will be vaccine availability, and we'll be working hard to make sure that people like you get that priority in 1B. And if we don't get some of the increased vaccine that we are expecting to get in March, we could have to extend 1B longer to make sure that people who are in their 70s in Chicago have had those opportunities, the great majority of them at least, to get that vaccine, just as we did with 1A and 1B. We had to wait a little bit here, right? We moved from 1A to 1B not as fast as some other states did, partly because we are still vaccinating healthcare workers from 1A. Yes. We want to make sure people have that opportunity. So we look at it, we look to see where do we start to see some of that demand slow down, and that's some of what we're looking at. But if you're in your 70s, you live here in Chicago, we are working to prioritize vaccine. And again, 1 in 8 have gotten vaccinated, which means 7 in 8 still haven't, but that's going to keep increasing week over week, and the data looks good. It's really showing us vaccine is getting where we need it to get. Good improvements in communities of concern, good improvements in age of concern, and good improvements in our highest risk, congregate settings.
All right. Well, I think we're at the point for some good news. I know that our positivity rate is good.
That's pretty good news. That we're feeling happy about this. We're not feeling cocky about this. We're wanting to be cautious, but it is really, I can't tell you how good it is to be seeing continued progress against COVID here in the middle of winter, which of course has been a concern generally. We are up against the elements here in a way that some other parts of the country aren't. But I do think I am pleased with the way, just in terms of good news, I'm pleased with the way the numbers are going. I'm pleased with the way the vaccine rollout broadly is going. We're doing a lot of work behind the scenes to fix reporting issues and continue to make sure the data is flowing better. And there's always things to work on, especially on that tech side. But I do think broadly that things are going well. And
we don't talk about mortality as much, but I mean, that's connected
Deaths
to
are
these,
also down. Yeah,
right.
thank you for that. We're,
Yeah.
you know, we're averaging 9 to 10 deaths a day right now across Chicago, which is still much higher than we want to be.
Yeah.
But it was 24 a day just a couple months ago as an average, and it was like 50 a day almost. It was 49, I think, was our peak per day as an average, with days much above that in the beginning of the first peak. So compared to certainly where we were, hospitalizations look really good. We have very good hospital availability right now. All of the metrics are looking good. We need to be cautious, particularly knowing how this can surge, watching these variants. But I do think we're doing a good job of pushing vaccine into the settings where it's going to make the biggest difference as we moved into 1B here, and just hopeful that, like that restaurant I looked into last night, people will continue to be cautious.
Yeah, we got to protect our progress.
We got to protect our progress and do this well. But I'm feeling good about where we are here at the beginning of February, and long way to go still, but progress in the right direction.
All right, that will be our good news for today.
That will be our good news for today and for this week.
Yeah. We know the Super Bowl's coming up. Dr. Arwady told us, don't get out of hand here.
That's right.
Yeah, keep our cool.
That's right.
Enjoy it, but you know, we've gotten so creative with doing things with people that we love to hang out with virtually.
Yeah.
And so we can put those good skills to use this weekend too.
Yes, exactly. So yeah, thanks for everything everybody's been doing here in Chicago. Patience, please, with the vaccination efforts. We've got a great system built here that is, as more vaccine comes, we can ramp it up like that. So good things are coming. Thanks.
Protect Chicago.